Hi, hello everybody. So I am going to be talking with you today about maternity nursing. Okay, so I'm going to talk about maternity nursing. I'm going to cover some different topics that falls under maternity nursing that you would see on the NCLEX exam. And what I want you to know, maternity nursing is going to fall under the category of health promotion and maintenance. Okay, health promotion and maintenance. So if you're following by the category, that's what maternity nursing falls under. Okay, so let's go ahead and get into it. So let's go straight into it. I'm going to start talking about it right now. Okay, so the first one, I'm going to talk about Apgar score. It's spelled APGAR, Apgar score. It's a type of scoring that we do in order to determine the health and viability of the newborn. Once as soon as the newborn is delivered or born, this is what we could use as the indicator to determine their health and viability and what they need, what type of care they need, or if they need any at all. So as far as for the NCLEX exam, what you need to know, so this is the part you want to write down, you need to understand what the score is, like what the numbers mean, and what type of interventions you would do based on the score number. Okay, let me say that one more time. For the NCLEX exam, when it comes to the Apgar score, you need to understand what are the appropriate nursing interventions that you would do based on the score or the number of the newborn. Okay, so I'm going to go over what they are, all right? And I have my notes in front of me as well. So the scores, there's different types of way that we score it, but the Apgar score is done. It's done usually within the first to 5 minutes that the child is born. So as soon as the baby is born, we take the baby, like we don't give it away to the mother immediately. Like we take the baby, make sure they can breathe everything, all that good stuff, and then we hand it over to the mother. So anyway, so the score is going to include these factors: the heart rate, the respiratory rate, the muscle tone, reflex irritability, and then the color are evaluated as well in the infant. So Apgar score is the baseline for all future observations. Okay, so when it comes to this, each parameter can have the highest score of 2 and the lowest is 0. So starting with, for example, the pulse. It can be as low, as far as like based on the scoring, right? It can be as low as 0 to as high as 2 based on what the numbers are. So let's say, for example, if they have a pulse that there's no pulse, right, which is really bad. If they have no pulse, then they would get an Apgar score number for that indicator would be 0. Okay, if the pulse is below 100, then it's 1. Okay, which is because it's not supposed to be below 100, it's supposed to be higher than that. If the pulse is above 100, then it's 2. Okay, so the range that it can be is from 0 to 2 for each indicator. Remember, it's pulse, activity, pulse, their heart rate, their appearance, the respiratory rate, the grimace or the reflex irritability, and then activity as well. All these things are the 5 things that, so it stands by the letter or the acronym. So A in Apgar stands for activity, meaning that how do they reflex? Do they respond back when you touch them? When are they having reflexes? That's what the A stands for. So if they have no reflexes, that's 0. Okay, if they flex their arms, which is not normal either, I mean it's a good thing that they're doing something, but that's not what we want. If they flex their arms and legs, that's 1, and if they're just active, that's 2.